From the book Treat Your Own Chronic Pain, the Chronic Pain Bible for doctors, psychologists and clients. Psychological interventions for chronic pain. Before I get started on psychological interventions for chronic pain, I want to be crystal clear that your psychologist or counsellor is probably the single most important person on your pain team, just not for the reasons they may think. I want to see 100% of chronic pain patients, that is for the type of pain described in this book, working with a psychologist who can provide therapy to actually switch off pain. It's not happening yet, but it could and should. I was unable to locate a single paper, systematic review, or meta-analysis which demonstrated a clinically significant effect on chronic pain levels for psychological interventions currently in use, being variations of cognitive behaviour therapy, mindfulness, eye movement desensitization and reprocessing, or EMDR, and many others. A systematic review and meta-analysis by Pike et al. Was representative of studies and papers addressing the utility of psychological interventions for chronic pain, and concluded by claiming that psychological interventions were useful for reducing catastrophic thinking, so what, but had no impact on pain, on health, on return to work, or on medication levels. It turns out that getting you to shut up about your worrying and your suffering has absolutely nil effect on your pain levels. Gosh, who would have thought? There is considerable evidence that no current psychological strategy has any effect at all on chronic pain, as well as evidence that any improvement in quality of life scores is due to the therapeutic liaison. That is your opinion of your relationship with your therapist, not the therapist's opinion, independent of any intervention the therapist might use. At present, unfortunately, the very best your psychologist can do is help you to feel understood and supported and help you to perhaps cope better. In other words, he or she might be able to help you reduce the impact of pain on your life, but not reduce the pain. It isn't possible at this time to determine how much is spent on psychotherapy for chronic pain patients in Australia, and the latest Deloitte report fails to even include this sector, possibly for good reason. It's currently looking like a dud. This shouldn't be the case, but that's the state of things for now. And that's a shame, because if psychologists had techniques and strategies that could actually help chronic pain clients, they would absolutely be the most appropriate and perfectly placed allied health professionals to fill the gaping breach in services. But first they have to stop doing what they're doing and learn a completely new approach. They still need their amazing compassion, knowledge, investigatory and communication skills, but they also need new strategies that actually work.